can see, that's fine, I don't care,
No,
but
it's
I'm just
fine.
saying. So if I put this on the test like this, if I had this on the test and I asked, what is the name of this appendage? Cheliped. And first question, right? Cheliped. And I said, is this appendage biramus or uniramus?
Uniramus.
Uniramus. So don't put biramus, okay? These are all walking sticks. And what comes out with it? What is that coming out? Yeah, gill. These are all uniramus, right? Uniramus. Uniramus. These are all swimmerettes. I think they're mostly biramus. So look at that one.
What
right
did they
there.
do with those?
Well,
What's
if the
the
female, remember, she'll put her eggs right there, and that'll aerate and keep the eggs clean.
Okay.
Okay. So these are all swimmerettes right here. Now, on the tail, this is the tail, but the middle one is called the same thing it is on the horseshoe crab, telson. And these would be the uropods. This is what? Biramus. This is uniramus, right? So we got the whole tail fan or tail. Okay? You got it? Okay. Now, the tricky ones are these little ones up around the mouth. And I can actually,
Is that the carapace? Or?
that's a carapace I'm tearing off.
Poor little thing.
Now, so this first one right here, that one is the third maxilliped, right? And if I pull it out, I don't know if I can pull it out, I'm going to try. I didn't do too good a job, it broke apart, but there would be their biramus, right? Because there's the two parts to it. Now, so that's third maxilliped, so the next one has to be what? Second maxilliped. So if I pull it out,
So does it go from anterior to like posterior?
it's going from ventral to dorsal, I guess, would be the best way to describe
Okay.
it. Yeah. So, see, that's biramus, right? That's second maxilliped. Now I should have one more maxilliped. And it's getting feathery and more feathery. It's not as calcified, right? So this one should be, let's see if I got anything. I got part of it, right? That's the the first maxilliped. And I think I've left something in here. But now I should have 3 more appendages now. So I've got third, second, first maxilliped. So the next 2 should be maxilla. So I guess I should have got some tweezers. But that's part of the max. I don't know if I've got both of them. I think that was part of the. Yeah, I think that's part of number 1 right there, and that's part of number 2.
Is that biramus?
I think one of them is biramus.
Okay.
I can't remember. And then what would I have here then?
The mandible?
Mandible. So I've got mandible, first maxilla, second maxilla, first maxilliped. I don't know where they all went. Second maxilliped, third maxilliped. Okay. So if I had this out like this, and if I had a pin right there, mandible, right? All right. So that's the appendages. Now, the only other thing you have to do basically is take this carapace off, and you have to peel it, and you have to be careful that you're not taking stuff with it when you peel it. Let's see how good we can do it.
Compound eyes.
All right, so now what we can see, and I didn't get it all here. Let's pull this off. Okay, all this then is what?
Gills?
Gills, right? Gills. So I got my gills all flared out here. Now the heart should be right in this area, but I'm probably going to have to remove some tissue to get to it. So I'm just gently.
There's a little veiny thing there.
Well, it probably is a vein of some sort. So I want to keep being real gentle. And I thought I saw it, but then it didn't act like it. All this tissue like this solid, creamy tissue, that's all digestive gland. But I am not seeing the heart. So I'll look for the heart in another one. But this is all hepatopancreas, or digestive gland. So now, what we want to do is we want to look at the stomach then. So the stomach is going to be right. There's going to be two little packages of stomach. But first, before we get to the stomach, see this little muscle right here?
Mm-hmm.
And then there's another one right here. That's the mandibular muscle. So that
That's what
controls the
opens and-
mandible. Yeah.
Okay.
So here's the stomach. There's a pyloric and a cardiac. Okay. So I pulled the stomach out, and they should. You don't see it, but you see that little. There's four muscles. This is the anterior gastric, and you've got posterior gastric. But if you look in the stomach, the one farthest away is going to be cardiac, and this is going to be pyloric. But if you look inside the stomach, then there's going to be gastric teeth because they have to grind their food somehow. So inside, you can see right there.
Oh.
There's the teeth, the gastric teeth.
It's weird.
Yeah, see those? Yeah, teeth in your stomach. Okay,
Saves a lot of time.
yeah. So there's the mandibular muscles, okay? Now, do you see that, those white lines right here?
Is that the nervous
That's
system?
nervous system, and so the supraesophageal ganglia would be right up in here. Those are all nerves. All right? Then, if we go a little bit farther, oops, I just pulled one out. This has to be what then? What structure? They look like little pancakes.
Green gland.
Green glands. Yeah, green glands. Green glands. See? There. Perfect.
They're not green.
No.
Very misleading.
disappointed.
Or they're also called antennial glands or whatever. But we're in greens.
So you
easy to
have
remember.
one pair?
One pair.
Okay.
Right there and right there.
They look like tiny kidneys.
Yeah, that's what I was thinking.
Yeah, little tiny kidneys. That's what they are. They're kidneys. But their
Hmm.
kidneys are up like, if they were in, it would be like right here on us, based on their orientation, right?
Mm-hmm.
So you got green glands, you got the compound eye. This is called the rostrum. Now, so let's look and see if we can find a heart. It's like Wizard of Oz, isn't it?
It smells so.
Good.
Terrible.
Okay, so see, I want to look for that heart, right? It's going to be, that's the only thing, when I point there, that's the only thing it could be.
And it's like above the tail.
Yeah, it should be right. I'm trying not to just, these are the adductor muscles. So that causes the tail to do this.
Mm-hmm.
When you eat the tail of a shrimp or crawfish, you're eating flexors, which do this. They flex. Like this is flexing. This is extension.
I know this is gross, but I'm kind of hungry.
There you go.
I'm not having much luck with a heart today.
I think you just got mean crayfish. So.
Heartless things. Maybe this male
I
had
feel
a
pretty
big.
heartless too if this is going to be how I ended up after.
Donating your body to science.
Right, so I'm gonna reabsorb my heart.
Out of spite.
That may be it right there, but it's all kind of flaccid. I wouldn't ask that on the exam if it looked like that. I'm gonna ask it if you can see the nice ostia,
Okay.
okay? Any questions on that? Does that make it pretty straightforward?
Mm-hmm.
So when you do your crayfish, or your sea star, if you do those, basically, you're going to cut one tip off, and then you're going to cut up the sides, and you're going to peel that back. And you got 5 chances to get it right. And then you're going to take a circle and cut around the central disc, and that's where you got to be careful. But again, I'll demo it just like I've done this one. I'll demo it next Wednesday.
Okay.
Okay.
Cool.
Who else needs a view? Anybody else?